then the last thing I wanted to bring up was, a lot of people aren't happy with the governor putting in a mask mandate, and none of us wanted that to happen, especially the governor. But we're in a situation now with this surge, like no part of this pandemic before, that, really it's the right thing to do. It was the right thing for him to do. And we all support that vigorously. We want to make sure that parents don't politicize this with their kids. Really, it's not fair to the kids to put them in the middle of this. Right. And it's for their best safety to wear a mask.
And can I tell you that unlike most states, Louisiana went back to school last year, right? Yep. So we had options, but some hybrid and some, but they were back in school. As public health, who monitors all of those children in school, and teachers and housekeeping and everything, janitors, bus drivers, we saw almost no in-school infection outbreaks. We had people who were sent home. A child may have come to school and possibly exposed other people. Not many, because they were very good at masking and social distancing. Most of the children that were exposed to each other were outside of school at some activity, either a birthday party,
church activity,
a birthday party, or a sleepover, or a bunch of teenagers got together and went to dinner. Whatever reason, they exposed each other outside of school. Very little transmission within school. We know how to keep our children safe, but it involves masking. And if you're not going to mask, this is what I always say. I had a superintendent before the mask mandate called and said, well, Dr. Whyte, we're not going to require masks. We're not going to do that this year. And I said, oh, you will. And he's like, what? And I said, well, in a few weeks, you're going to have outbreaks, and then you're going to have school closures, and then guess what? You're going to require masking. Because there's just not a choice. It's so contagious. It's going to spread like wildfire if you don't wear a mask.
And children are much more vulnerable than they were in the first round.
That's right.
A year ago.
Well, we see that on the numbers.
That's right. Exactly.
And the other thing,
put that back up there, Kath, that graph, if you don't mind.
My daughter's school district, where her children go to school, they sent out a petition that they will not wear masks and they'll take responsibility. And she had the best response. And she said, okay, so you take responsibility if your child gets COVID. So you're going to pay my child's medical bill?
Yeah, that's the
Right.
part
that's
not even
Are you
really
going to take
considered.
my child's responsibility?
Or mine.
Or mine? And if you're not going to do that, then what is the best lesson for our kids? Take care of your brethren. Take care of your fellow student. Take care of each other, and wear a mask.
Those parents who don't want to send their kids to school with a mask, they can homeschool.
Sure.
There are other options for them.
Right.
They can use virtual technologies. There are ways that they can do that. But to
K through 12.
politicize it
Yeah.
for our kids is just not a good way to
It's
do it.
not
I'm
acceptable.
only bringing it up because you brought it.
Yeah.
The younger people are affected now. They weren't before.
That's
And you can't see the less than 18, but they're that little orange dot, see,
right.
Keith, right at
Right
the top?
there.
That, it's
Look at that.
underneath the yellow.
Look at there.
And
Here.
it's
All
higher
the
than
way
it
to
was
there.
at the peak.
Yeah.
So this is why, when it comes to data, this is why, please, if you're watching, listen to what I'm telling you. They're just trying to help you.
Right.
This is what's so frustrating. What do you get a pay increase, by the way? Are y'all getting extra bonuses for this?
Are you kidding me?
No.
Oh, you mean
We
you're
work
not
for the
getting-
state.
You mean the CDC?
We all work
We all work for the state.
The
We all work for
CDC
the
is
state.
not sending y'all money extra to do that?
No. And neither are pharmaceutical
let me
companies.
tell you-
Are you sure, Dr. V? This is what's so
In
crazy.
the
I'm
height
like,
of this, how many extra hundreds of hours
that you
overtime
didn't get paid. Oh, that's what's
in
so
a week,
ridiculous.
in a pay period,
Yeah.
This